Hi, my name is Randall A, and I'm a reproductive endocrinologist and infertility specialist in Orlando, Florida. And a few moments ago, my wife brought me a little gift, these orchids over my left shoulder. Orchid is Latin for testicle, and an orchidectomy means removal of the testicles. I don't know if there's some implied message there, but we're going to go ahead today. We're not talking about orchids, we're actually talking about ova, or eggs. And we're going to talk about donor eggs. And this is a major growth mode in reproductive medicine because America is graying. The demographics are changing. So there are more boomers and millennials who are getting into the age where their ovaries are not working so well, so they need fresh eggs from a 20-something. Now, a little curious note, the first donor egg pregnancy was established in 1983, and the baby was born in 1984 at my alma mater, UCLA. At UCLA, Dr. John Buster, one of our colleagues, took an egg from one woman and used the sperm from the second woman's husband to fertilize that egg, and she developed a healthy pregnancy. Now, fast forward to 2013, things have changed remarkably. Just over the last several years, we've been able to reliably freeze egg cells. Before a few years ago, we were not able to do so, but through techniques perfected in Japan, we can now reliably freeze eggs, and better than 90% of those survive. In fact, that can be better than 95% in some clinics. So why would we use donor eggs? Well, there are some women who have to undergo chemotherapy or radiation therapy for cancers. There are some women who have autoimmune diseases. There are other women who have decreased ovarian reserve, meaning few eggs because of age, or for unexplained reasons. Other women have genetic problems such as Turner syndrome. That's where one X chromosome is missing. So instead of 46XX, as in the normal female, Turner's patients have just one X, 45X. There can also be dysgenetic gonads. In other words, the ovaries don't develop normally. So gonadal dysgenesis is another reason that a woman might need donor eggs. So you might wonder how common donor egg usage is. The CDC in Atlanta, the Centers for Disease Control, has reported about 50,000 births in this country through this technique, going back to 1984. So there are a couple of ways of using donor eggs. One is you can use fresh eggs from a synchronized donor who is going in parallel with your cycle, or you can use frozen eggs, which have already been banked. There are several different banks available now, and you can buy a lot of 5 or 6 eggs, fertilize those, and place those into your uterus. So with the fresh synchronized donor, there might be 15 or 20 eggs available, leading to the possibility of maybe too many leftover embryos. But with 5 or 6 eggs purchased, we would anticipate that 3 or 4 of those might become embryos, 1 of those might be transferred, and maybe 1 or 2 left over for future usage. So we know that these donors are young and healthy. They've been screened well by history and physical examination, a genetic questionnaire, psychosocial counseling, and they don't have hereditary diseases. Because these donors are young and healthy, the embryos resulting from their eggs are usually good, so we just have to put back 1. Well, the donor goes through extensive screening. What about the recipient? We would like the recipient to have psychosocial counseling, to have medical informed consent, and to have a legal contract drawn up. It's important to realize that this baby is your baby in every way, shape, and form. You are the legal parents of this baby, so the legalities of this are obviously very important. You know, I guess we really do come full circle to orchids. A few weeks ago, a 45-year-old woman contacted me. She had seen one of our ads for egg donors in a local college newspaper. And she said, you know, I will do better than just donating eggs. I will give you an entire ovary. My whole ovary I'll give you. And just for the heck of it, I'm going to throw in both of my husband's testicles. We didn't go there. Anyway, that's orchidectomy. I'd like to see you back next week. Please tell your friends about our infertility channel. If you have comments, leave them below. And if you have comments or questions of a personal nature, please write me. I'm going to incorporate those into future episodes. Thanks so much. See you next week.